Spring allergy season is ramping up. I know this for myself.
Feeling it.
Yes, and it's causing a lot of sniffling, sneezing, and other symptoms as well.
I know, and as the tree pollen counts climb, so does the misery for many, count us included. Our Dr. Frank McGeorge is here with the 4 facts you may not know about spring allergies. Doc, I'm all ears.
Well, here they are, Pam and Christy. You know, local experts say they are seeing more people suffering from spring allergies over the last few years and more patients reporting more severe symptoms. And there are several reasons that make sense.
Seasonal allergies affect up to 30% of the world's population, but many people don't realize you can develop allergies at any point in your life.
Oftentimes, people will develop allergies in their childhood, and then it peaks in young adulthood. But then there's other people that will develop allergies later in their 30s, 40s, 50s, or even later.
Certain people are also more likely to develop allergies, says Dr. Marielle Benjamin, an allergist at University of Michigan Health.
You can be more predisposed to developing allergies if you have a family history of allergies. And so say your mother had allergies or your father, or they had asthma, you're more likely to develop allergies yourself at some point in your life. If you're exposed to certain viruses when you're young, or if you live in a city environment versus a rural environment, that can change your risk for developing allergies.
A U of M study also found allergy season is starting earlier and lasting longer.
Unfortunately, climate change is making our allergy seasons longer and also making the pollen levels higher.
As higher pollen counts trigger more severe symptoms, more people are not finding relief from over-the-counter medications.
If you have more moderate to severe symptoms, that's when I would recommend seeing an allergist who can help test you in clinic and find out more specifically what you're allergic to, can also give advice on what medications to take and when to take them.
Now, this also means that more people could benefit from allergy shots or immunotherapy, but it really is important to see an allergist if the over-the-counter medications that you're using are no longer easing your symptoms.
And so, Doc, what about people who have indoor allergies? How does that factor into everything?
Well, so that is actually becoming a more common issue. People will be allergic to tree pollen, but then also dust mites, for example. So tomorrow morning at 6 a.m., I'm going to walk you through the mistakes that you could be making indoors that are actually making your outdoor allergies worse. And they are actually more connected than you might think.
Interesting. Looking forward to hearing that. Thank you, Doc. Appreciate it.